Hi, my name is Ron Hallman with UVM Health Network Porter Medical Center. And today we are recording an interview with Dr. Natasha Withers and with Nate Lamberton, who is our primary care pharmacist at Porter Medical Center. And the purpose of this conversation is to share with you our new enhanced primary care model at Porter and each of our primary care practices. And Natasha and Nate are going to share some of their thoughts. So Natasha, let's start with you. Let's just go big picture here before we get into the pharmacy part and have you just generally describe enhanced primary care and what is it and why is it different than what people have been used to historically, and some of the advantages for patients.
Absolutely. So we are taking a different approach to how we do primary care that is more patient-centered, so a care model that's designed around the patient. We really wanted to make sure that we meet the needs of our patients in the moment they declare they have a need. And thus we are building a bigger and more robust team so that we can meet those needs. Additional team members that we are adding are ambulatory pharmacists, Nate, who you'll hear from in a minute. We are adding additional nursing support, additional behavioral health and mental health support. We also are building up our community health team that includes dietitians, additional mental health support, and care managers. And we will also in the future have some health coaching available for our patients.
Great. So it's basically a team approach. It's, rather than having your care provided exclusively by, one person, there's a whole wraparound team of multidisciplinary folks, different types of providers who are available to sort of deal with whatever comes up in terms of a patient's need. Nate, let's talk about your role as a primary care pharmacist, which is a term that some people may not be familiar with. We're used to going to the local drugstore and dealing with our pharmacist there, but you're actually going to be working differently. Can you talk about how you're going to be supporting patient care?
Yeah, so I'm embedded actually within the primary care clinics with Porter, which is kind of a unique opportunity to wrap back around to what Dr. Withers was saying and really help the patient who has unmet healthcare needs. And what that looks like in a primary care pharmacy sense primarily is surrounding chronic disease management. So patients who have multiple complex chronic diseases who use medications to manage those, it's another service to help patients understand better their medication regimen, to identify gaps in therapy, to identify issues accessing medications and therapies, whether that's a financial burden, whether it's just an inability to use particular medications or devices that we use for certain disease states. So it's another access point for patients to really meet their individual healthcare goals when it involves the use of medications.
So if I was curious about, will this generic drug work just as well as the name brand drug? That's the kind of question you could help me answer. Is that fair?
Yes. So establishing generic equivalents of medications is one small part of the process.
Right.
A much larger, I think, role that I feel is working directly with patients' healthcare providers, their primary care providers, to determine what are appropriate medications. So if we need to use medications to treat disease states, we should really make sure we're using the most appropriate ones, the ones that are affordable, and the ones that provide benefits, to multiple different diseases. So we know there are certain medications that we use for diabetes that have far-reaching benefits beyond just blood sugar lowering. So reducing the risk of heart attacks and strokes, preventing diabetic kidney disease. So when we're thinking about medication management, we're thinking about the optimal use of medications, and that's probably the larger role that I serve in patient care.
Okay, and this model is going to be implemented at all the primary care practices at Porter. So that's Middlebury, Vergennes, and Brandon, right? So Nate, you can't be in 3 places at once. So what are the options for if you happen to be in Middlebury on a certain day and a patient is in Vergennes, what are other ways they can connect with you if you don't happen to be there that day in person?
Yeah, no, that's a great question. And I'm always accessible, and that's really what it comes down to. I do spend my time across all three clinics, and I rely a lot on the relationship I've developed with the patient's primary care providers and the healthcare team to keep me informed when patients are reaching out about medication-related concerns, chronic disease-related concerns, and the like. I'm also very well versed in communicating with patients through my chart messaging. So patients who see their provider who have questions can get routed to me through there, and I can respond. So really, from my perspective, although I'm physically in different locations every day of the week, I'm always accessible to each location, and each need that arises is met with that same level of concern. And if it's an urgent concern for a patient who might be here in Middlebury while I'm at Virgins, it will get addressed. So that's something to keep in the back of our mind, that I'm always accessible. And that's the take home point, is that when patients have questions and they have concerns, community pharmacists and that relationship is incredibly important. But the service that we can provide here in the clinic to help address some of those needs is also important as well.
Right. So one of the criticisms that we've heard over the years with medical care, it's very disjointed. You see your primary care provider here, and then you have to go somewhere else to see a dietitian, and then you have to go somewhere else to see a different type of provider. So Natasha, talk about the different types of services that are going to be truly integrated into the same space so that people can more conveniently access, from one end of the spectrum to the other, and hopefully meet their needs a little bit more quickly.
Absolutely. So the services that I described will all be embedded into our clinic, and that will be somewhat of a hybrid model. So much like Nate's role, we'll have people in the clinic at times, and then they will be virtual or available by phone or video, depending on the day and the needs of the patient. So we want to make sure that patients have access to all of these services when they need them, whether that be physically in the office or virtually. I think it's also important to point out, specifically around our behavioral health services, this is somewhat of a newer model to have it embedded into the primary care practice, which is not only convenient for the patient, but perhaps more accessible. So patients who otherwise might not have reached out for behavioral health because they had to go to a designated behavioral health office can seek those services in a more discreet fashion in our primary care practice.
Okay. And you also have folks, I believe, that are embedded in these practices that can help folks with their insurance, right? And questions about billing, and do I qualify for different types of things? Will my insurance cover it? That's a whole nother part of this program, right?
Those are our care managers who can help with all of those things that you mentioned, as well as food or housing questions. Nate's role can also support that as well, specifically around insurance questions or co-pays for medications. So there's several team members that might be able to support a patient depending on their need, but the majority of the services that you mentioned are handled by our care managers.
Okay, and then we're talking about being managed by a team of people. But if you're my provider, Natasha, and I really like you as my provider, am I going to have to give you up because now I'm being cared for by a team, or do I get to still see? Do I get to still see you every once in a while?
Yes, you absolutely get to see me. So it's a question we often get. So I do want to reassure patients that they absolutely will continue to see their primary care provider, and that will be the main point person. But I think in this model, the value is that you'll have more team members to answer your questions and who know who you are. So not all of our providers are in the office every single day. And you may have a need that needs to be addressed in the day that your provider is not there. So it's really important that we have additional team members that can answer your question to get you an answer in the moment that you need the answer, rather than waiting for your provider to come back into the office. But your provider will always be looped in into any decision making and be aware of anything that's going on with your health.
Okay. And how does telehealth play into this? Is there any? Are you still going to be offering that? Is that part of this whole setup? What's the deal there?
Telehealth will absolutely be part of this setup. So patients can access their providers or any of the team members for that matter through regular office visits, through video visits, or phone visits. We also have a telehealth service, if you will, that does eye exams for diabetics, that sends pictures to an ophthalmologist up at the medical center. So that's a different version of telehealth and also an extension of our team. So all of those services will be available for patients and are available today.
Okay.
Ronan, do you mind if I jump in for a quick
No,
second?
please do. I was just going to
Awesome.
turn it back to you, Nate.
Yeah, because I really wanted to emphasize what Dr. Withers talked about and managing that relationship with your PCP and not being taken away from that. Yeah, I think my role as a primary care pharmacist, even provider is how I see myself, is really to help manage some of these uncontrolled chronic diseases to allow more time in the visit with your PCP to focus on other things that are not just the disease states that we keep talking about. Like patients are not identified or defined by one disease state, and helping to manage some of these more complex diabetes or high blood pressure or cholesterol on a one-to-one basis will allow a much larger discussion when they return to their PCP. It's not going to be that same discussion over and over and over again. So I think that's something important to hit on. And this team-based approach is that really ultimately it's meant to put the patient at the center of the discussion and make sure they're always getting all of their needs addressed, not just the ones that we in healthcare see to be the most pressing ones. And I think it's really important to highlight that. And I think Dr. Withers put a really good emphasis on that in her response too.
Super. Well, this is great. What have we missed? Is there any final words? I don't want to make this too lengthy. I think folks can check out our website. There's a lot of information on our website, or come and see you all in person and have a conversation. But any last words of wisdom you'd like to share with people who are interested, or?
Yeah, I think from my perspective, what I always like to highlight is that none of what we seek to do here from primary care pharmacy services is meant to replace anything else that's done. It's really augmenting and enhancing the care that's already provided to add a different level of care to that patient as well. And although I'm a pharmacist who's readily available in the primary care clinics, this is by no means meant to replace the relationship patients have with their community pharmacist, because that is still an incredibly valuable connection and resource. But I just come at it from a very different angle. And I have a lot of experience communicating and working with community pharmacists. And I think that relationship can ultimately help with the journey from prescription to pharmacy to patient, and then complete that cycle in a way that the patient has the information that they need and that they understand. So really the patient is at the forefront of this all. And I really think anybody who has questions, just ask, and really there's always something we can do to help, whether patients realize that or not. So really have questions, ask, get curious about it, and I'm sure we'll cross paths at some point.
Super. All right. Well, you guys have been outstanding. Thank you. A lot of information covered in a small amount of time. So again, for anyone who's interested in more information, we have some new pages on our website. Just go there and click on primary care, and you can get all kinds of great information. So thank you both for your time and for all that you're doing to serve our patients and serve our community. Thank you.
Thank you.